Imagine living a life without psoriasis, without the itch, without the plaques. Today I've got a guest, Brad, and he's going to talk about the integrative approach when it comes to psoriasis, and particularly a case study which we were looking at. Hi, Brad. Thanks for taking your time out for your busy schedule. How are you going?
Yeah, good. Thanks for having me.
No problem. So, we're going to talk about this psoriasis case, which you're an expert in. And we're going to unlock about that integrative approach, which is quite different to that orthodox treatment of putting creams and quick fixes on. So, would you like to share that case with us?
Yeah, look, it was a case of a 38-year-old female with severe psoriasis since the age of 20. And the practitioner was a naturopath who's used homeopathy, nutrition, and lifestyle changes over several months and got some really good results. And
Yes,
really, this case really shows what can be achieved with a holistic approach or an integrative approach.
yes, yes. Yeah, and that's what we really like to share with listeners and patients and that how you've got to unlock that different way of thinking and think about how that holistic way is far better than just putting a cream on it. Yeah, so can you share some of the keys of that treatment? What was special about this case?
Yes, so the psoriasis was very severe and like she had it since the age of 20, big plaques. So it was very significant. It was something that when you see this sort of case come into your clinic, okay, this is going to be a long-term thing. It's not
Hmm.
something we can throw at it and expect immediate results. And the practitioner's approach in this particular case was the homeopathic remedies were initially what she started with,
Mm.
and then over time working on more significant dietary changes. And how she went about it was very good too, because these things can be very intimidating, restrictive
Hmm.
diets and whatnot.
Yes,
And how it was incorporated over several months, and then introducing botanicals, so your herbal medicines and so
yes,
forth. It was really well done and
yes,
integrated in a way that were she adapted to the patient, which is our speciality, really, isn't it?
yes. And share with what was her skin like before the treatment and how was it impacting her life?
Yeah, look, it was severe, and I think her scalp, arms, and legs, even on her glutes and between her legs and so forth, was really dramatic and it was painful. So we often think of psoriasis as an itchy, irritating autoimmune skin condition, but it can be quite painful. And in this particular case, the patient was in tears a lot. She was struggling to cope with life and moving forward. So, yeah, it had a major impact on her life.
Yeah, understandably, you got little shivers then thinking about that because the, that's what happens. The patient's sitting in front and they've been all around and they've tried all sorts of things, and then they start to get unlock that and get results. It's really life changing. And for her to go from that state to drastic recovery, it's amazing. And that's what drives us, isn't it?
Yeah, exactly. She had low iron, vitamin D was low,
Yes,
hormones were out, metabolic health was a problem.
yes,
Cortisol was a problem for stress, and even the GI symptoms like chronic diarrhea were present. But
yes.
it's looking at labs and seeing those results, that's one thing. Daily weeping, fear of mirrors, and not having success with medical interventions like steroid creams and this sort of thing, which is very common for us to encounter with our patients. They've tried the medical approach and it's been unsuccessful and sometimes can even exacerbate the situation as well.
So you just touched on a little bit about testing, and maybe if we can expand on that, or you could expand on that and share with some of the tests she would have done and a bit more of what was found.
Yeah, so standard bloods and covering iron and also doing a test for vitamin D. So vitamin D is very important because it regulates the immune system, and
Uh-huh.
psoriasis is an autoimmune condition. So we need to understand where vitamin D is at. And
Yes.
as she mentioned in the case, you can't just go in with high vitamin D and expect to get results.
Yes.
However, and I say this to all my autoimmune patients, if vitamin D isn't right, if that's running too low, you will not resolve an autoimmune case in most
Interesting.
circumstances.
There's a great
So
take.
it's an important marker. And then metabolic health, she had markers that were indicating insulin resistance. If you're having sugar in a inflammatory condition, so psoriasis, we consider that an inflammatory condition, even though its main mechanisms what we call hyperkeratinosis. So this
Uh-huh.
proliferation of skin just constantly being
And over
constant,
and yes.
yeah, keratin growth just keeps on growing and shedding. But there's this inflammatory response going on as well, which can contribute to the pain and everything that she was feeling. Yeah, the insulin resistance, that coming up is an indicator that the blood sugar's dysregulated,
Hmm?
and
Yes.
that I always explain to my patients that if you have sugar in an inflammatory position, when you have an inflammatory condition, and you add sugar to the mix, it's like adding kerosene on a fire.
Ah,
So
perfect analogy.
again, if
Yes.
we can help with the insulin resistance or the metabolic imbalances, we can hopefully prevent a lot of the pain and further distress.
Yes.
So yeah.
And then also gut was really important with this case. Can you expand on a little bit about that?
Yes, so like typical autoimmune conditions, we often see what we call leaky gut,
Uh-huh.
where there's usually dysbiotic cause, so an imbalance in the microbiota, your gut bugs. And this was certainly the case for this individual: constant diarrhea, some uh, gut symptoms that were uncovered as the
Yes.
case went on. And then that needs to be corrected. And so the imbalance, the dysbiosis needs to be corrected. And then we need to repair the gut. And I think this was done with things like gut healing powders, like such as glutamine and the
Yes.
likes, and mucilaginous herbs. So these are herbs, things like slippery elm that coat the gut lining and act like a prebiotic as sorts, and help fuel the good bacteria to create a good environment to enable healing of the gut mucosa.
Yeah. And even other conditions, gut is quite a core. And it's if patients are struggling with things, it's always a good start to start with the gut. But as in this case, really super important. So for the listeners out there, can you give any tips and tricks of helping with their psoriasis and where do they start? What do they do?
Yes, so I think you've got to address so many facets of this condition. There's a mental and well-being, emotional side of it that needs to be looked at, and which was dealt with beautifully in this case. And the
Hmm.
homeopathic remedies assisted in that sense as well. And the patient also did, I think it was meditation and breathing exercises, and adopted that really well. So the stress management was critical in this condition. And we often see that in many autoimmune conditions, and I would dare say all of them. You need to really have that as part of your treatment, stress management, and whether you're capable of doing that yourself, but it's always best to try and incorporate other people in helping you, going to
Hmm.
classes like yoga or Pilates, or seeing someone for counseling can also be a
Yes.
great benefit in that regards too. So you need to address that aspect of it all. The gut health, which we've gone through, that was critical, and monitoring with regular pathology, whether it's every few months, and seeing if you're moving the needle as such, and
Most
getting the
definitely.
results you need.
Yeah, because as in this case, she did those tests and she found those markers out. So just monitoring them, is it going in the right direction? Is the inflammation coming down? Is the D going up, etc.? Yeah, excellent. So thank you for the time again. It was really valuable for those listeners. And is there anything last word you want to add?
No, I think again, this case just highlights the importance of an integrated approach. Homeopathy was used, counseling type techniques, breathing and lifestyle interventions like that, and good nutrition, managing the diet and managing it in a way that you're not putting further stress on the patient, which was done beautifully in this particular case. And then, of course, the gut health, the botanicals and nutritional supplements were used, but used
Yes.
sparingly and used wisely, and nothing too much was ever in the mix. And it was done perfectly over a set period of time, and the practitioner was adapting well to the case over that set period of time and getting the results, which at the end of the day, the patient was able to be out and about, didn't have the
Yes.
fear of mirrors and the
Yes.
constant weeping, and all that went away over a course of several months. So it's a fantastic turnaround and great results, and just shows the strength of holistic integrative care.
Excellent. I can see your passion shining through. You're always so generous with your advice. And unfortunately, there's too many things to add and hard to put your finger on one. But thank you for sharing that.